All right. Well, thanks for sticking around, and thanks for joining us, and thank you for listening and watching our fourth guest for the day. We're going to bring on here in a second Dr. Colin Mendelsohn. You may remember Dr. Mendelsohn came and joined us, I think it was 6 months or a year ago. He is the author of the book Stop Smoking, Start Vaping, a passionate and outspoken advocate for tobacco harm reduction in Australia. So please, everybody in chat and even in the replay crew, put your hands together and welcome Dr. Colin Mendelsohn all the way from Australia.
All the way from Australia.
Thank you very much, Alex and Kristin. Nice to see you again.
Great to see. We should have had you on sooner again. But boy, with being Australia, that really does make things interesting, doesn't it? Trying to organize these.
The time zones are always tricky, but no, it's nice to be back. Thank you for asking me.
So as I mentioned, of course, the last time we had you on, we were talking about your book and things going on in Australia. And I did want to, this is a great opportunity to follow up. How is your book doing, and what kind of feedback have you received from folks?
Yeah, look, I think the book really fills a need. One of the biggest problems we've got with tobacco harm reduction is misinformation. And the book basically tries to set out the evidence. I mean, it should be so obvious, really. The evidence is very clear, I think, that this is a life-saving technology and we should be making it widely available. But the misinformation and misperceptions are just mind-blowing. And the book sets out the evidence, it's fully referenced, but as well as that, it gives people a practical guide, if you're a smoker, on how to make the switch to vaping. And I think for both those purposes, it does fill a need. So I think the book has been very useful for some people, and hopefully it will be for more.
I'm sort of curious. I assume because you pay attention to all of this stuff, probably heard about sort of the recent dust up. I think, was it Medscape or MedPage? They had done a program. It was actually it was an unrestricted grant from Philip Morris, and Dr. Sally Sattel and Brad Radu had put together this program that was directed at doctors. And from their reporting on it, it sounds like it was tremendously successful. Doctors were very appreciative of the information. And so that sort of, first of all, I'd love to hear, your take on that whole situation, but also kind of dividing any feedback you've gotten about your work from, between professionals and consumers and perhaps, I think we all know what the anti-tobacco folks think of all of this, but sorry to throw a lot at you there, but.
No, look, I followed that Medscape issue. I didn't see the actual educational package, but the feedback about it was excellent. And it's something that we desperately need. I mean, doctors are so misinformed about vaping. When they read the media, they get misinformation from their associations in Australia and in the US. And here was a package by two independent experts to simply educate them about vaping, and it was working very well. But because it had tobacco company funding, it was canned, and there was a huge uproar. Now, I really think we've gone too far with the tobacco companies. Yes, they've behaved appallingly in the past, but what we're talking about here is tobacco harm reduction, which has a huge potential for public health and to save lives. I think we've got to recognise that tobacco companies are transforming. I mean, it's slower than we'd like, but they're heading in the right direction, making healthier products. And we're not endorsing their smoking products, but I think we've got to, at some point, acknowledge that what they're doing can improve public health, and we should support it. And it's kind of there are people in tobacco control whose main objective seems to be to destroy tobacco companies and to punish them. And I think that's just childish at this stage. I think we've got to take a broader, more mature view now, because look, they have money, which, if it's untied, can be used for very valuable purposes.
Yeah, and we've always said, and I know that we probably talked about this before, from an access point of view, the tobacco companies already have the infrastructure in place. They've got the contracts with the convenience stores. Their cigarettes are everywhere still. and that is one of the best places to reach the most people with safer alternatives. So I mean, the argument is that they absolutely have a role in fixing this. And speaking of how tobacco companies are transforming, I know in the United States we have the Tobacco Control Act that basically forces the companies to be transparent. The saying is, don't ever write anything in an email to a tobacco company unless you're comfortable with it ending up in front of a judge or splashed across the media. So, I mean, I'm curious in kind of trying to transition into how things are going in Australia. Does Australia have something similar that holds tobacco companies to account? Or is it just kind of left up to the NGOs to live out this, destruction?
Not that I'm aware of. I mean, they're constantly under attack, and quite rightly. But I think, I think things are changing, and we have to adjust to that. I think they can play a role in the solution. I mean, no one's endorsing their past behaviour and their sale of cigarettes now, but we know they can't stop making cigarettes, and there's always this outcry, well, they shouldn't be making deadly cigarettes. How can they be genuine? But we know they can't stop. And but I think they could contribute to the solution, and I think we need to give them the opportunity. And look, the research they produce, I think, is high quality. There's a lot of dodgy research in the tobacco harm reduction field. What's run by the tobacco companies, I mean, it has to be of a high standard. They're subjected to huge scrutiny, and their research is actually quite a high standard. It's very hard to fault it, and they're very conservative in their conclusions, I think.
Yeah. So I think you've maybe opened up the door a little bit here to talk about prohibition and how things are going in Australia. Of course, I'm keying off on this idea that we're going to forcibly eradicate cigarette sales. And I think, at least from our perspective, from my perspective personally, I would rather have a company that is regulated and accountable manufacturing deadly cigarettes than somebody's fly-by-night operation out of some nondescript warehouse in the middle of the woods. And we know that will happen. But Australia has a different problem with this prescription-only model. We had the benefit. I had the benefit. I hope you got to watch some of the e-cigarette summit in DC.
Yes, I saw your presentation. It was excellent. Yes.
Yeah, Ben Uden did a great presentation comparing and contrasting New Zealand and Australia. And I think, most of our members and guests, watching today, probably already know what's going on, but maybe you could give us a little bit more color about how things have been going since the last time we talked to you.
Yeah, look, Australia's regulation of vaping has been a resounding failure. It was originally established this way to protect young people from vaping and to make vapes legally available to adult smokers with medical support. But it's failed miserably in both areas. And we have one of the highest youth vaping rates in the world. And over 90% of adults don't use the legal market. They use the black market. So because it's so hard to get a prescription, so very few doctors will write prescriptions. The doctors are anxious about it. They're skeptical. They're very poorly informed. So to vape legally, you need a prescription, and then you need to get your supplies from a pharmacy. Very few pharmacies sell these products, and those that do have only a small range. And the products that are available now are only in menthol, mint, and tobacco flavour, and there's a very limited range. So vapers are saying, look, I'm not sick. Why do I have to go to the doctor to get a product to, first of all, to find a doctor and then to find a pharmacy who can provide supplies and then get what I want at twice the price? So they just go to the black market, and our black market operators have just stepped up. We had a huge illegal tobacco trade. Legal tobacco is 25% of the market because we price tobacco out of the reach of people. It's the highest cigarette prices in the world. We really messed that up. So we've got this thriving illicit tobacco industry run by organised crime. And they've stepped up and said, well, we'll just add vapes to our offering. Vapes are a very low risk, high profit industry. You can buy a vape for $2 or $3 in China, ship it to Australia, sell it for $30, $40. It's big money. As one of the criminologists said at a hearing recently, you only need to get a couple of containers full, even if 8 are picked up, you still end up making a profit. So, it's just been a red flag to the organised crime groups. And with organised crime, what we're seeing is a huge turf war that's developed, which is so typical of these drug wars. I mean, the organised crime groups don't go to the judge and say, well, he took this from me and he's moved into my area. They just shoot each other. And we've had fire bombings in the last 18 months. There's been at least 80 shops set on fire. So they recruit young kids to hijack cars and bash them in, bang them into these tobacco and vape shops and set them on fire. There've been homicides, there've been drive-by shootings, extortion, intimidation. It's typical drug war stuff. And this is now, the vapes are now the second biggest illicit drug market in Australia.
Wow.
The second biggest illicit drug market.
On that, I saw an article the other day and it just blew my mind. They were talking about the fire bombings and all the things that are happening. And it was something with, I just couldn't believe it. This is the circular thinking to try to avoid doing the right thing. The police were warning landlords don't rent to places that sell vapes and stuff because you could get firebombed and stuff. So rather than ending the drug war, they're trying to end the stores. I mean, it blew my mind. I couldn't believe it.
Yeah. Well, the vape shops themselves, the legal vape shops have disappeared in Australia. Right. They aren't allowed to sell not only nicotine, they're not allowed to sell coils. They're not allowed to sell bottles for e-liquid. They're not allowed to sell flavoring. So they're gone.
What are they called again? Dairy stores? What do you call them down there?
No, that's in New Zealand. They have dairies. No, we have convenience stores, but they can't legally. We have convenience stores, but they can't legally sell these products. They can only be sold by a pharmacy with a prescription.
Right.
So the legal shops that used to provide the advice to smokers. So if you're a smoker who wants to switch, how the hell do you do it? Well, you used to go to a vape shop where former smokers who are now experts in this would advise you, and they were saving thousands of lives. Now they've all closed. Where do you go? The pharmacists have no idea. The doctors have no idea. It's a big problem. So we're making it harder and harder. Instead of making it easier for adults, we're making it harder. And the black market sells freely to kids. Yep. Now, they don't respect the age of sale, and they sell much more attractive products than the government will allow the retail outlets. So basically, we have a prohibition model and a typical response. And, it's totally predictable, and it's only going to get worse.
Yeah, as you were talking, I was thinking about, I guess it was 2 or 3 years ago, I think the Truth Initiative had put out something that it sounded like they were sort of shifting on their position as far as harm reduction goes. But what they were proposing was very close to a prescription only model, where you could only buy these products in adult only stores, and people had to, sign a log book. At the end of the day, cigarettes were still more accessible than vapor products. And so I think the question that came to mind was, do you know of people in tobacco control who are seriously looking at the situation in Australia and maybe having second thoughts about implementing similar policies in their countries?
Well, the people in Australia in tobacco control have just doubled down. They've said, look, okay, the first ban didn't work, and look, the second ban didn't, but the third ban will definitely work. We just need to ban harder and close more loopholes. They just don't get it. They just haven't learned from history. But there are other countries that are looking at our model.
Yeah.
Ireland and Scotland have talked about it, Canada. There are people in New Zealand that are saying, but they do this prescription model. That should work. No, it doesn't work. It's an absolute disaster. And unfortunately, they hear from our tobacco control people who are saying, this is going to work. This is world leading, and we're leading the way with this, and if we'll get this right and it will work. No, it won't. It will not work. And now the history of prohibition is very clear about that. We banned heroin in 1953 in Australia. The latest drug survey found that of people who use drugs, over 90% say it's easy or very easy to get heroin. You cannot ban these products. If people want them, they will find a way. The banning just pushes it underground, and it makes it more dangerous. You get no tax. The products are not regulated. They're sold to kids. The legal industry gets destroyed. There's just so many predictable consequences. And I think Australia's model is a good model for what not to do, not for something to be copied.
Yeah, and obviously, maybe it's not so obvious, but all of that added risk of people going to the illicit market is clearly not deterring people from
No.
using drugs.
Did you have the same thing happen? I mean, because we keep trying to warn people. I mean, just a whole big bust happened in New York, and we actually just tweeted about that the other day, and we said, look, we warned you. We said this was going to happen, and you poo-pooed it and said, oh, no, you're just tobacco shills. You're just, you're exaggerating things. This is not going to happen. Did you have people do the same thing, in Australia too, that you can turn to and go, you said there wasn't going to be a black market. You said this wasn't going to happen, because that's what they're saying here. Oh, that would happen.
We predicted this when they started cracking down on the prescription model 3 or 4 years ago. We said to them, the Australian Tobacco Harm Reduction Association published stuff on this and said, this is what's going to happen. Mm-hmm. This is what is going to happen. We're going to get a thriving black market, increased sale to kids. The tobacco shops the vape shops will disappear, and the smoking rates will decline more slowly. And it's exactly what's happened. So it's no great surprise. It was entirely predicted. But there's so much hubris in our tobacco control community. They think they're world-leading experts because some of the things they have done have been very good. And for a while there, our smoking rates were declining quite rapidly, but then they slowed. And I think we've gone about as far as we can go with cessation. And really, we need to now look at tobacco harm reduction. I mean, that's the next phase. But they've decided, no, we don't quite like that approach. We like to do it our way, which is people have to quit. It's like, don't use drugs. We know how well that works. Yeah. And we've gone, I think, as far as we can go with cessation. We just know there are lots of people who just can't quit, who want to, and for whom switching to safer nicotine products is the solution. And we have to embrace that if we're going to progress this any further.
So, when we were having some, writing back and forth, and obviously we've already talked about New Zealand, and we talked about the Ben Uden's presentation at E-Cigarette Summit. There's a stark contrast between declining, that slow managed decline in Australia versus a steep drop in New Zealand. And you sort of referred to that as, New Zealand basically has what could be model policy for the rest of the world. What is so great about New Zealand's policy that's working?
Yeah, look, New Zealand has really embraced tobacco harm reduction. I mean, it's supported by the government. It's supported the Ministry of Health. It's supported by most medical charities and health organisations. The government endorses and encourages people to make the switch. It's got educational websites. It encourages the use of vaping in its quit smoking clinics. It's kind of integrated into their stop smoking campaigns. And the results have been astounding. Since August 2020, when the legislation was passed, over the next 3 years, the adult smoking rate fell by an unprecedented 43%.
Wow.
43%. And the adult daily smoking rate is now 6.8%.
Wow.
In Australia, it's declined over that same 3-year period more than twice as fast as in Australia. Australia's coming down, and a lot of that I think is due to the fact that we have a lot of illegal vaping. So that's, I think, why ours. Of course, the tobacco control people will say, well, that's because all our campaigns are working. No, it's because 1.7 million people, about 7% of Australian adults, are vaping, but not nearly as fast as in New Zealand, because in New Zealand it's encouraged. The rates of vaping are higher. Vaping has a much more positive image, and that's the huge difference it's making to public health, and not only to the overall adult smoking rate, but the Maori smoking rate has declined dramatically. And as well as that, the Indigenous population, and as well as that, the low socioeconomic quintile has also dramatically declined. We all know smoking is a huge social inequity issue, and that group has also had dramatic response. So it's been across the population.
That's great, because we haven't had the same in minority groups, indigenous groups here in the U.S. We haven't seen the same thing. It seems largely more of a middle class thing. You know, the middle class still the ones who still smoke. You know, and then because the richer you get, I guess, the less you smoke or something, or just there's less people who are that rich. So to smoke.
Well, the smoking rate in the indigenous groups are high everywhere in the world. In Australia, they're still around 40%.
Right.
And the rate of decline is slow. I mean, we throw huge amounts of money at it, but it's really only declining very slowly. I think in New Zealand it's in the low 20s now, and that's largely because of in recent years of vaping, and that's why I find it so frustrating, because we can see the Maori smoking rates declining so quickly, yet in Australia, the indigenous population are resistant to vaping. And a large part of that, I think, is because that's just the message they keep getting from the government, and their funding is very much linked to what they link to government funding grants. So they kind of close their eyes to vaping, but meanwhile, it's a huge public health problem for them, and we've seen that what they're doing in New Zealand works.
Yeah, and I know, here, Juul, I think, got part of the Juul crucifixion involved them, I think, going into a reservation and directly targeting a community, and I
heavily
think
smoking community.
right.
Yeah, well, right. I mean, where's the common sense in that? This is an obvious group that could benefit from a health point of view.
Right.
That's where the stigma of the tobacco companies gets in the way of public health. It should be about helping these people to quit. It shouldn't be about, well, let's make sure they don't make any more money and let's punish the tobacco companies and marginalize them. That shouldn't be the priority. It should be, how do we prevent cancer and heart disease and lung disease?
Yeah, one of the more frustrating things about all of this is that the data was showing that the independent side of the vapor industry was actually competing with the tobacco companies, and part of that was before everything got put under the umbrella of FDA regulation, these companies could operate and with all the flavors and devices and nicotine strengths and everything that was attracting people who smoked to the products. I'm a big, and this is where harm reduction works. It's about inviting people in and giving them that friendly option of, this is better. You don't have to force people or beat them over the head to get things to happen. And so we had that competitive market, and I know this is where we get into kind of conspiracy theories, which aren't like wild conspiracy theories right now, because tobacco companies actually are trying to push other challengers out of the market. And with our Tobacco Control Act, it essentially gave the incumbent tobacco industry safe harbor from competition, insulated them against any innovations that came along. And unfortunately, FDA is actually doing the work for the tobacco companies right now.
Killing competition.
It's just so frustrating that it's like, consumers actually supported this revolution and had probably the best chance in decades to really injure the tobacco companies from a financial point of view. And then the FDA stepped in and just protected the big companies. And
it's only provided approval for products that they make anyway.
Right. Yeah. They took the top 5 companies by market share and gave them priority. And anybody else who's still on the market is they're only there because of a court-ordered stay against marketing denial orders. When
I think about the mess in Australia, the only thing that comforts me is that we're not the only countries that totally stuffed it up. I mean, the US really, if you don't mind me saying, I mean, this whole FDA pre-market approval, post-marketing, now what do they call it? Anyway, the
pre-market
PMTA
tobacco application.
Yeah, I mean, it's just a ridiculous situation. The control that they have in they can make their own decisions without apparent accountability. and to restrict the market to that extent is just ridiculous. I mean, this whole panic about youth vaping, the youth vaping epidemic, is just absurd, really. It's just all out of proportion.
Yeah, and I mean, it's I don't even want to qualify this with arguably. We were never there to begin with. What we saw was a spike in experimentation and sort of misrepresenting the numbers. But now it's we're down around 10% for past 30-day use, which is that's kind of normal. I mean, that's lower than other drugs that we see kids using.
Well, that's right.
So
and
much under 2%.
Short term anyway, and a lot of them are smokers, of course.
Oh yeah, I mean, and the high school smoking is under 2% now, and one of their main arguments in the early days was, well, this is renormalizing smoking and it's going to lead kids to smoke, and that's been resoundingly disproven. I mean, if that was true, we'd be seeing all the smoking rates going up in teens, and it's gone down to the record lows, yet they're still doubling down on this whole youth epidemic thing. Speaking of youth, what did you think of the New Zealand? It's kind of on hold now because of the new government, but the whole thing that they were trying to do with the phasing out the generational ban by age. What did you think of that? And do you think it's going to rear its ugly head again? Because that's going around the world too. People, oh, what a great idea.
Look, I personally have never supported the ban, the generational ban. I think it's a good idea in theory, but I think it's too late for that. As you mentioned, the smoking rates amongst kids already incredibly low. I don't think the problem is kids taking up smoking. I mean, if 1 or 2% in Australia, this daily smoking rate in 12 to 17-year-olds is 0.3%.
Oh, that's already okay.
Yeah, 0.3%. In our latest national survey. And I think a plan to focus on preventing uptake amongst kids when the numbers are so small, which wouldn't start anyway for a few years, will have missed the boat. What we need to focus on is the 40 and 50-year-old adults who are long-term smokers who can't quit. And our surveys show very clearly that the quitting rates are highest in the groups that have the highest vaping rates, and that's in the 18 to 24, 25 to 34 age groups. And then after you get about past 45, 50, people stop quitting. And they're the ones that aren't vaping. And perhaps there's a message in that we need to, if anything, encourage older people who can't quit to consider taking up vaping. And in Australia, it would need to be properly legal and regulated and accessible for that to happen. Those people are less likely to want to buy it from the black market. But we're just making it as hard as possible. And I know that's the same in the US. Your older smokers are also quitting.
Right.
Yeah, and I know actually. So we're gonna blow through the fourth wall here, and this is pre-recorded. So I do know that in our lineup we have already talked to Annie Claycamp, and she's been focusing on some of her work on older people who smoke. I think primarily sort of 65 and up. Things that I assume we will have talked about this, but one of the messages that people hear is that if you quit by the time you turn 40, you are likely to experience a full recovery. You won't experience these smoking attributable diseases. So I'm sort of curious, and I'll set this up with a personal story. When I was in treatment for substance use disorder, there were some older folks in there. And I know, one gentleman in particular was, mid to late 60s, and he had I think had stayed out of recovery, didn't seek any help or support because he was old enough to the point where it was like, well, I'm going to die soon anyway, so why bother? Meanwhile, he's got grandkids and kids and family who really care about this person, but he's not really seeing the benefit. So I'm kind of curious, number one, how solid is that number of, by 40 to save yourself from the worst of smoking? But also, do people in their 40s hear kind of a dual message? On one hand, it would be a good time to quit. On the other hand, why bother? Because I'm already sort of locked into a certain amount of suffering.
No, look, the answer is that from the ages of 35 to 40, if you quit, you have a normal life expectancy. It's more about life expectancy. So the average smoker who loses on average, long-term smoker on average, 10 years of life. From the age of 35 to 40, so after you smoked 20 years, after that point, every year you keep smoking, you lose 3 months of life expectancy on average. And that's kind of permanent. I mean, statistically, every individual is different, but statistically. So it's never too late to quit. So as each decade goes by, you will, if you quit, you will live longer, but not quite as long as you will have if you quit the previous decade. So you're never too late. It's never too late to quit. I mean, not only will you live longer, but you'll feel much better. You'll have a better quality of life, and you'll save a lot of money. So I think they're pretty hard figures. There have been a number of very big studies that have been published that confirm that figure. They all keep coming back to that same kind of figure, 35 to 40. So the sooner people quit, the better. And that's why I don't support cold turkey quitting, because what happens there is this is the least effective method we've got. So what happens is people will try it each year, 20, 30 years. Eventually they might quit, and people say, oh, there you go, cold turkey worked. But what's happened in the meanwhile is they've done permanent damage. When they could have quit earlier, if they'd, say, vaped and used something which we know works, they could have saved themselves years of life.
And that makes me... Oh, go ahead.
I would just to add to that, Carl Phillips, used to be on our board, and I know that he was fond of letting people know that, especially when we talked about the risk associated with vaping, continuing to smoke for 30 more days will do more harm than picking up vaping, quitting smoking, and using vapor products for the rest of your life. Exactly. It's a clunky thing to get out there, but I thought that was always a really important point to make. Sorry, go ahead, Chris.
I linked to that too. I was going to say that people who've smoked for 20 years and then stop live a normal life. So if you're a vapor and your risk of smoking is less than 5% of what it is as a smoker, I would have thought that there's a very good chance that you could vape for many more decades because the risk from vaping is so small. And even with smoking, you can have the improved life expectancy still by quitting by that age.
Yeah, it's the same thing with the never smokers, that they like to use in studies, and they like to say, we just don't want these kids to ever start vaping because, it's not healthy or whatever. But they ignore the fact that there's going to be kids who start smoking, and
exactly.
Regardless. And if those kids start vaping instead of smoking, they'll have been never smokers, but they'd still be much better off than if they had started smoking. But they have this delusion that, well, this kid would never smoke, or they have this Pollyanna-ish sort of idea of what the world would be like if everybody didn't use nicotine. It's
I mean, the nicotine's not going to go away. Even a few people smoking is a disaster. That's whereas a few people, a large number vaping is a relatively minor health issue. I mean, better they don't do either, but of course some are going to do one or the other. And the kids they've voted to vaping. I think that's a good thing.
But you'd think it was the most horrible thing ever if you listen to these people. There's a nicotine addiction for the rest of their lives, and it's like, but they probably would have been smoking.
The risk of addiction, it's such a big and emotional issue. These kids are going to be a new generation addicted to nicotine. Well, I looked at the Australian figures, and about 3 to 5% in our two major surveys of kids overall said they may have trouble quitting vaping. So the addiction level, if you base it on self-reports and what the kids say, 3% of kids vape daily. So it's kind of in that ballpark. There's only a small number who are at risk of nicotine dependence. And so what? Nicotine dependence is not harmful. It's not a disease. It's unpleasant for a week or two. You quit smoking or quit vaping and you go through some withdrawals. It's not like quitting smoking. It's not such a big deal. And even if these kids vape for 20 years, what harm is it doing? Okay, there's some compulsion to vape, and there are times when you can't, and that's inconvenient. But this is not a fatal condition. I think the whole nicotine addiction thing, we blow out of all proportion.
Yeah, it's so funny because I see people saying that, and I'm saying, usually it's some upper income woman who's saying, oh, and I just think, well, how many Starbucks did you have this morning, ma'am? Because
Yeah,
it's
yeah.
like, that they've got their own little things, and but nicotine's so horrible. What I was going to say before, I was going to just mention, because we did talk about your book, and you were talking about all these statistics and health and such. And if you could just real quick, for those in the audience who don't know, what was your background before you got into all of this stuff?
Yeah, so I've been in medical practice for 40 years. So I've been a clinician, seeing patients, an academic. I was an associate professor of public health at the University of New South Wales, and done quite a bit of research as well. So I started off in general practice, but soon became interested in vaping and smoking, and more recently in vaping. And my interest in vaping came about from seeing patients and hearing that, yeah, vaping was working for them. For people who tried to quit, and suddenly they were vaping and being successful. And clearly it was offering more than just the NRT. It was giving them the hand to mouth and the sensations of smoking, the social aspects of smoking, without all the poisons. So, I went to the UK in 2014 and met with Clive Bates,
Okay.
Martin Dockrell, Peter Hayek, who were just wonderful and still are. And, that just reinforced my beliefs, and I've followed the research very carefully ever since. And, I'm just staggered that we have formed policy in Australia which doesn't follow the science. And yet, our health minister just keeps lying about this. He says the tobacco company has created these products to addict a new generation to smoking. He says vaping will increase your chance of becoming a smoker 3 times. And we're not going to let a new generation get addicted to nicotine on my watch. And there's all this brain damage. I mean, I just can't watch it anymore. Yeah, well, yeah, I won't go there, but I just can't watch it anymore. And he keeps saying it over and over, and some of it sticks.
It's crazy.
Yeah, he'll be accountable one day, because clearly this is not going to work. But that's the power, and the media, unfortunately, is on side. The media love these clickbait stories, as you've discovered in the US.
Even in the UK,
very negative.
Yeah, even in the UK, the media just jumps on.
Yeah,
Well, certain media just jumps on all of it. And he doesn't even care. He doesn't even look and say, oh, look what's happening in England. Look how the smoking rates for youth are going down in the US after that peak. He doesn't care. None of that matters to him. He doesn't see that as evidence at all, clearly. It's crazy that they just ignore it. The cognitive dissonance or whatever it is.
The drop in the US is extraordinary. The 60% decrease in youth vaping. It's dropping in New Zealand. It's dropping in Canada. It's actually plateaued youth vaping in the UK, but in Australia it's going up, and we've got the higher youth vaping rate because of our easy access through our black market. We've got a higher vaping rate than most other countries, and it's going up. It will continue to rise. The black market isn't going away.
And the funny thing about that too, with everything that's been going on around the world, especially since the pandemic, and what's been going on with our children, and how that kind of all the studies are coming out saying that's messed up our kids, not being in school and just all that stuff, then not being able to be social. You see a lot of things with mental health and drug use and things like that. Here, fentanyl has just been awful. And you have to wonder that if that tick up in nicotine use, in vaping nicotine, if they're not, as long as they're not, I'm sure that a lot of them are vaping THC too, but you'd have to wonder if they weren't using the nicotine and using that as sort of their outlet or their being a rebel or whatever, what would, if vapes did not exist, you have to, they don't ask, but they should wonder, what would these kids be doing otherwise? Would they just be at home and doing their homework and making their bed and, drinking their milk, or would they be out there, binge drinking and using other kinds of drugs and other stuff that is a lot worse than the vaping? You have to wonder if the uptick in vaping has other things,
Yeah, which leads me to something else I've been very interested in, and I've written about, which is that we don't endorse kids vaping, but when you do a risk-benefit analysis of vaping, for by kids, the overall public health benefit is there. It's overall a net benefit. So when you weigh up the benefits to kids from vaping, so this is diverting them from smoking, and we know that the smoking rates are accelerating downwards. It's helping kids who do smoke to vape and stop smoking, and there are positive benefits. Kids are vaping for anxiety and for ADHD to help cognition and memory. So there are all these benefits of vaping. And when you weigh that up against the risks of vaping, and I've had a close look at the risks, there's really not a lot there. There's a lot of misinformation about popcorn lung and brain damage and asthma, lots of things, and seizures, pneumothorax, which are nothing to do with vaping nicotine. And when you weigh it up, I think overall, and not only that, these are kids, if their parents vape, who aren't going to lose their parents, whose family budget will save a fortune.
And that's the thing that happens a lot, is that a lot of times it's the younger person who, because they say generational smoking, the chances if your parents smoked that you would, but a lot of parents, I've seen a lot of stories where they said, my son or my daughter, they switched to vaping and that's how I got into it. So it trickles up in that kind of.
Yeah, it goes the other way. Yeah. And the kids aren't getting the secondhand smoke as well. I mean, there's so many, and not getting the role modeling from their parents. There's so many advantages. So overall, I mean, we have all this panic about youth vaping, but I think overall, if you do a proper risk-benefit analysis, it's beneficial. I mean, it's a bit controversial to say that, but that's been my assessment. Yeah, no one wants to hear that. And I'm not encouraging kids to vape, but stepping back.
But we're realists. We're not idealists. We're realists, as Clive's article was about.
Yes, exactly.
That was a good article he just had too. Go ahead, Alex. Were you going to say something?
Well, I first of all did want to point out again, referencing back to the e-cigarette summit. And I was sorry I had to turn away and thumb through my e-cigarette summit program to find the name. Dr. Amanda Graham she's the chief health officer from the Truth Initiative, and she gave a presentation about the Truth Initiative's app to help kids stop vaping. And I don't know if you were able to watch her presentation, but a lot of folks found that very interesting because the quit rates among youth were astonishing, honestly. And I think it was Professors Mermelstein and McNeil were on a panel following Dr. Graham's panel and made the point that we never would have seen quit rates like that when kids were primarily smoking. So the implication, if there is sort of an unspoken implication, which actually did come from a question from the audience, was that is it perhaps that vaping is less addictive than cigarettes, even with that ease of use and how kids can, progressing to habitual use happens actually very quickly because you can get away with using it very frequently. But even with that, it seems that young people it can't all be because of the power of this app. It's not, I don't know that it's that much more than, what we've seen in other strategies. But I just thought that was a really interesting point to bring up, especially when we talk about, having honest conversations with kids about what nicotine is, what it does, what the risk and benefit is. It seems that it's not nearly as dire as the campaigns would make it out to be.
And look at the 60% decline in youth vaping in the US in 3 years. I mean, where's the addiction in all that? And look, there's no question that there have been numerous studies that have assessed dependence on smoking and vaping and found that there's a significant difference, and vaping is generally significantly less addictive or less dependence forming than smoking. And for lots of good reasons. We know why that is. It's because with e-cigarettes, the nicotine levels don't rise as quickly, which is a really key element of addiction. And also there are all these other chemicals in smoke that make nicotine more addictive. So it's no surprise. And the studies use all sorts of different ways of testing that, and they've consistently found that vaping is less addictive. So that's another advantage.
Tobacco itself, has not necessarily addictive other chemicals, but has beneficial chemicals that are, what are those called?
You
your
think of the
mood
MAOIs?
MAOIs, you know, it's got
Yeah.
other 'cause I've told the story many times, but when my husband and I switched back in 2009, I found it relatively easy to once I got a good flavor, I was done with cigarettes. But my husband just kept saying, "There's just something missing. There's
Yeah,
something
he needed
missing."
something. Yeah,
We
yeah,
were adding menthol and more flavor and higher nicotine
yeah.
levels, and he just it never quite did it. And that's one of the reasons why he started using snus.
Snooze.
And
Yeah,
it was the
yeah,
snus that gave him those
yeah,
MAOIs or
yeah,
whatever it was that gave him and you
yeah,
can't I don't know if those are addictive, but they were he found those beneficial for his
yeah,
for things that he has that made the difference. And from that point
yeah,
on,
yeah.
he was able to, just vape
Mm,
and hadn't smoked. So that was one of the reasons why, and that was back in the early days when CASAA was
yeah,
being formed. It was one of the reasons that when I learned that about snus, because I had the whole, "Oh, chew, bad for you," "Oh, no, you're gonna get
yeah,
mouth cancer," and stuff, and I got
yeah,
straightened up by that, by doing some going down some rabbit holes, and that made me very angry that we had been lied to about that, and that's one of the reasons why CASAA is a THR organization
yes,
and not just that's
yeah,
why vaping's not in our name, and we had to figure out a way to do
yeah,
that with
yeah.
the message. So
Yeah,
yeah,
and look, snus, I've heard that a number of times with snus, and I think it's a lot to do with the other alkaloids. There are other
right.
chemicals.
That's what the yep.
Yeah. So like nicotine with different names and which have a similar
Right.
effect. But there in smoke there are other ingredients which
Oh
I
yeah.
don't know if monoamine oxidase inhibitors are in snus, but certainly they are in smoke. But
Yeah, he
in
didn't,
nicotine,
you know, the snooze did it.
yeah, but people who switch just to pure nicotine often need something extra, and there are other ways of getting it. That's very smart what he did.
Yeah, yeah. And
And of
I'm
course,
glad
we've
I
got
learned about that too.
Nicotine pouches are growing in the US as well.
They are. I'm a big fan, obviously.
Yeah,
My
yeah,
husband uses those now, actually. I don't think he uses snooze as much. He uses the pouches, which maybe just gradually just didn't need the
yeah, yeah.
that got him off the
Maybe.
cigarettes, just having alternatives. Imagine
Yeah,
that.
exactly, exactly. It's all about whatever works for different people, and snooze and nicotine pouches are pretty low on the harm continuum. I mean, they're
Oh,
not
yeah.
hailing anything anymore. Nicotine and really not much else.
It's
The,
like a
the
Oh, but
nicotine
flavoring,
pouch for your
it's not
gums
they're
enough
the
or a
next
nicotine
horrible
patch.
thing
even
here in the
inhaling. So I
US.
think it makes a lot of sense.
Yeah.
Oh, you gotta keep them from those teens, though. The teens love them.
Yeah, yeah.
That's what the old
That'll be the
people in
next scandal.
Congress are saying.
Well,
Yeah, 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 yeah.
we are trying to keep this to a tight hour here. We're be respectful of your time and also stay on our schedule. But I did before we wrap things up, and we got about 12 minutes here. I did want to talk about the state of consumer advocacy in Australia.
Mm,
My memory is I think I had seen that you tweeted something out recently from a group that looks new to me,
mm,
but
mm.
I understand that it's been a challenge to get
Yeah,
adequate consumer representation in all of these. I'm sure, of course, people gobbling up the propaganda left and right isn't helping things.
mm,
But how has the consumer gotten involved, been listened to at all in Australia? And I'm just going to ask the question. I mean, what are the
yeah,
downsides of not
yeah,
paying attention to
yeah.
to the consumer voice in this?
Yeah, look, I think one of my big disappointments has been the lack of engagement of consumers in Australia. We have 1.7 million adult vapers, which is 7% of the adult population. Now, politically, that should have a huge impact if that group was active. And they could be, because for many of them, this is a huge issue. But one of the problems is that they're reluctant to stick their heads up because vaping is illegal for most of them. They're not getting scripts, and they don't want to take the risk of it being taken away. So there is a reluctance. They understand that. There was
Makes
a branch of the New Nicotine Alliance in Australia, which went for several years. I think they closed down about 5 or 6 years ago, and that was partly there were personality issues, and there were it just imploded, and that stopped. And more recently, a new group called ASCA, which stands for Australian Smoke-Free Alternatives Consumers Association, started up about a year ago.
Wow,
But
and
they,
made
there's
worse than ours, Alex.
yeah,
Not
yeah,
worse, but
they've also
longer. Longer.
They also decided to go for the wider range of tobacco harm reduction options, not just stick with vaping. But they've been sort of slowly building and developing, websites and social media presence, but they're still getting organised. Just recently, you may have seen a group called Alive. It stands for Australia Let's Improve Vaping Education, and that's
Okay.
run by
That's a
a
nice
very active vaper in Australia called Pippa Star,
Oh
who's
yeah.
really
Okay, yeah, I've
makes a
seen her
huge effort.
Twitter.
She's really energetic and really switched on and very dedicated. She's forming this grassroots consumer group. She publishes stuff, and she has social media stuff, and she has webinars,
Good
and
for her.
so the consumers are starting to make a bit of noise, and I think they have to. And I think as things become more and more desperate, they're realizing, well, if they don't speak up, this could all be taken away, which I think has
Yeah.
always been a distant threat, but now it's a very real threat.
We
And
have
and the
what,
other
like, I was just gonna say we have like 11 million people who they say vape in the US,
Yeah,
I believe. And like
yeah,
our um membership is under 300,000, and it's
yeah.
just to get, and then we probably have a few hundred that are the and that's big. I mean, that makes us what, probably the biggest consumer organization in the world at this point. But yeah, it takes a
Getting
few
people
really
engaged.
super dedicated and
Yeah,
driven and slightly crazy people like us
yeah,
to keep doing it. And it's a lot of work, and it's like herding cats sometimes. And so yeah, I can
yeah,
see. And I think
yeah,
sometimes in the US, I don't know how it is in Australia, but in the US, it used to be that you got charged more on your health insurance when you were using tobacco. Well, now they've added nicotine to that.
mm,
So even if you
mm,
completely quit smoking, you still
yeah,
get dinged. And it's just another one of those
yeah,
things that just takes away yet
yeah,
another incentive to
yeah,
switch. But it also could
yeah,
take away an incentive of, I don't want my insurance company to find out that I use this
yeah,
stuff,
yeah. That's true. That's
and
another
who knows
factor.
what it is. So yeah, I understand.
Yeah. No, but we really need to get that group speaking out more. But when they do speak up, they tend to be ignored. So we have Senate or government inquiries, and vapers put in their submissions, and we really get the impression they don't take any notice of them. They
Hmm.
listen to the AMA and the Cancer Council and the Heart Foundation, and they say, oh, yes, all our leading health organisations say this. And oh, yes, some consumers said this, but really, these are the people that know what they're talking about. So
Yeah,
it
not the
kind of
people who are affected
undermines.
by it.
Yeah, that
What's
was
that?
I think one of the questions sort of embedded in that is it's all about sort of patient informed policy. I think I might be
Mm,
getting that wrong, but here we see that there are groups that not specific to tobacco and nicotine. I mean, we're the closest thing to that, but in other areas, do you see a lot of patient advocacy? I hate to say patient and sort of
mm,
broadly
mm,
apply that to drugs and nicotine, but is there generally that kind of maybe culture in the medicine and policy world that we do need to hear from the voices of people being affected by these policies, or is this
yeah.
issue that you're seeing ignoring consumers more widespread throughout other issues in Australia?
Yeah, look, I think it's more widespread. I think it's always hard to engage people. People have busy lives, and people don't want to necessarily get involved in something like this. There are always that small group of people who have lots of energy and motivation and will work hard at it. But as you know, if you run an organisation, it's very hard to engage people that come in and actually do things and commit themselves to helping with an organisation. So I think it's a problem across all areas. But I think with vaping, because there's a stigma about it, and because there are legal issues, if you haven't got a prescription, you're a criminal theoretically, and most people don't have a prescription, and you need one if you're going to speak out. You don't want to take that chance. But vapors are discriminated against. They're just smokers who are still using, blowing out disgusting smoke, and then they're seen in a negative light, and which frustrates them. And they're finally given up smoking and done what everyone has asked them to do, and doing something healthy, which is not harming anybody else, but they're still discriminated against. So it's
And they're
pretty
worse off
unfair.
than the people who smoke, because the people who smoke are doing so legally.
Yeah,
The
yeah,
irony of
that's
that.
right.
The irony of that.
Yes, I know. And they can buy their products just at any outlet in Australia. Just 40,000 outlets sell tobacco, but you know, to get vapes legally, you have to jump through hoops, and it's
They
just
just don't
absurd.
get it.
Well,
Yeah.
in the closing minutes, I know I don't like to end all doom and gloom.
We do need to talk about where he is right now, though,
Oh,
as
well,
this is airing.
at the time of this recording, you are, I believe, probably, well, at the time of when this airs, you
Yeah.
are probably
Yeah.
traveling back from
Yeah.
Poland. You would be attending the
Yeah.
GFN. So I was maybe this is the positive note to end on. Maybe talk a little bit about GFN and what it's bringing to the debate globally,
Yeah.
and how more consumers can get involved. I think
Yeah.
in that conference and other stuff.
Yeah. Look, it's a long way away in Poland, but it is on the 13th to the 15th of June, and I try and get there every year. And what I like about it is that it's a very inclusive and comprehensive program. So people from consumers are very welcome, researchers, academics, but also manufacturers, even tobacco company people are welcome. The idea is to bring everyone together to find solutions. It's not about stigmatizing the industry. It's not about just what we think. It's about how can we find an overall solution. So it's been running for many years. I think it's the earliest tobacco harm reduction conference, and it goes every year in Poland.
Did
And
we
they have
say
an
what
interesting program.
GFN stands for? I'm sorry. Did we say what GFN stands for? I think we've been calling it
Yeah,
GFN.
Global Forum for Nicotine. Global Forum for
Global Forum
Nicotine.
for Nicotine.
Yeah. So they have the usual papers presented. They have workshops. They have videos. I'm presenting a video on youth vaping. It's all about honouring the memory of Michael Russell, who made the famous statement that people smoke for nicotine but die from the smoke, and the whole field of tobacco harm reduction is based on that. And this conference is all about honouring that memory and the resulting technology and life-saving technology that we've seen coming out of it. So
that's amazing. That's great.
the thing I like is that going to this conference is like going home. You know, you feel you can talk to people who get what you're talking about. They're not hostile. They're not misinformed. They understand. They're supportive. Whereas in Australia, you know, I might do a radio interview and they say, "But doctor, you're the only person in Australia who believes this." And I say, "Well, actually, there are a few others, but if you go overseas, you know, most of the professional organisations and governments actually do believe what I say." But so when I go to the GFN, it's kind of, here I am at home with people who get what I'm talking about. So I feel it's a really nice place to be.
That's cool.
One of these years, I hope to be able to afford going there, and both the time and money to travel. It is an excellent conference, and I recommend to view it remotely. It's just a free registration. It's a great resource once it's up. The time difference is hard to deal with. I'm not going to be up at 3:00 in the morning watching GFN, but it is on replay, and a lot of good stuff it comes out of there. So highly encourage our members.
The best thing about these conferences to me, though, is being there in person, Alex, to do the networking, to meet the people you've been talking to and reading about. But Alex, you've got no excuse. I was at the Washington Summit overnight. It was started about 10 o'clock here at night, and I was up till about 6 in the morning watching it. So you've got no excuse. You can definitely watch it online.
Well, I may give myself the voluntary stay-at-home jet lag to catch up on some of the stuff at GFN. It is a really good conference, and I'm glad that you get to go every year and meet everybody. And we do need that. Everybody needs that support. It's good to find that collegial oasis in the seas of lies and Bloomberg-funded propaganda. So,
I love that line. Did you hear that? Hey, collegial oasis. Oh wow, that's fantastic. Yeah.
All right. But we've reached past our hour, and we're going to have our next guest coming on soon. So, Colin, again, thank you so much for being so gracious and giving us your time today. We really appreciate it. Hope, as this is airing, you're having a great time over at GFN and networking and all that. And we have to have you on again soon sometime.
Yeah, no, that'd be great. And look, keep up the great work. I think CASAA is so important, and I hope everyone supports you, because if without the consumer support, it's just not going to happen. So keep up the good work.
Appreciate that. Appreciate
Excellent.
that. Thank you so much. Okay.
Thank you, and have a good trip.
Bye. Whoop. Sorry. All right. Well, we're done with this segment, and we will end this now, and we will be back live in just a moment.
We'll be right back.
We will be right back.